So I just want to take it back a little bit to the lab, right? Not in deep details, but I have to ask because you've been called, on by people in high places, President Trump being one of those people. I have to ask, how is your research shaping the world?
I would have never thought that I would be like in this moment right now. I mean, I wake up sometimes and I'm like, and are we living in a like an alternate like universe? Like, what is
Right,
really going on? Like, God is shaking the table. Like, that's what's happening.
right.
The research that we're doing is what we have essentially planned to do. I kind of have to say that with some level of kind of like, because what this is a demonstration. This vaccine response is a demonstration for readiness, for
Mm,
pandemic preparedness. So what happened with this novel coronavirus is not news, right? Zoonotic transmission of viruses, influenza, avian influenza was an example. HIV honestly is an example of zoonotic transmission. Um, and previous coronaviruses as well. So it's not new that this is something that is imminent, right? And so our team, under the direction of Dr. Barney Graham, has been kind of, in so many ways, planning for this moment.
mm,
And what is happening right now is the vaccine antigen that we designed with our collaborators at the University of Texas, Austin, Jason McClellan group, is being deployed into phase 1 clinical trial under Moderna, which is a biotech company. And that phase 1 trial started 66 days after the viral sequence was released, which is, to my knowledge, the world record
right.
for this. Usually, vaccine development and that to that end, takes a year or two, right? We were able to deploy a sequence to an industry partner, have that industry partner manufacture clinical trial grade material, have the FDA approve what's called an investigational new drug product review, and then start a clinical trial on the opposite coast of the United States, which is in Seattle. Actually, today we are announcing our second site in Atlanta, Georgia. But we were able to do all of that in 66 days, and part of the reason is because we planned.
Mm,
And so I think what echoes and should echo across the world is, number one, this ain't gonna be the last time. Okay, where there will be other viruses that jump into humans, we need to understand how we can be even better prepared. People have been bragging, oh, 66 days, that's a world record. I'm upset
mm,
because it probably could have been 30 had we taken some of our MERS mRNA constructs all the way through phase 1 already and really understood their safety already. We probably would have had expeditious rights to go into a phase 2 trial
mm,
already. And so I think that there is always room for improvement. I'm hoping that what our team and our collaborators kind of together are doing is setting a standard for pandemic preparedness.
mm.
And I'm hoping that what echoes to people with the pocketbooks is that all of this happened because I was afforded the opportunity under Dr. Graham's funding mechanism in his laboratory to have a team that has been studying coronavirus vaccines and designing coronavirus vaccines for the last 5 years, right? And if we had to see the sequence and do everything that we did over the last 5 years, we would be probably receiving protein right now, like from animal studies, not even humans, right? Like, so there's something to be said about planning